Hi, this is Crystal. Today we're going to talk about EMDR. So, what does EMDR stand for? EMDR stands for eye movement desensitization and reprocessing. It is an effective treatment for those who experience trauma induced symptoms like flashbacks, trouble falling and staying asleep, intrusive thoughts, difficulties concentrating, and having negative self belief. It is a nice guideline recommended treatment for PTSD, but it is also effective for areas like bereavement and developmental trauma. What is trauma? And what are the symptoms of trauma? Trauma occurs when people experience distressing events that cause lasting emotional and sometimes physiological responses. It is important to note that trauma is a subjective response. In other words, the same events can be experienced as a casual occurrence for some people, while it can equally be experienced as something that's incredibly distressing for others. The symptoms of trauma includes flashbacks, meaning that when exposed to reminders, the person might respond as if they are being exposed to the experience all over again. It also includes intrusive thoughts. They can't help thinking about the event, difficulties falling or staying asleep, and if left untreated, the person might then develop somatic symptoms like IBS or negative self beliefs. What happens when we experience trauma? When we encounter a traumatic experience, the brain interprets it as a threat. To shorten response time, our brain takes a shortcut and uses only the limbic system, which controls our basic autonomic responses, to make decisions. In other words, our primal instinct takes over, so we don't need to think through our decisions. Many people know this as the fight or flight response. This mechanism is designed to save lives. However, when the threat is over, the memory is imprinted in the amygdala instead of the hippocampus, where we store most of our episodic memories. The amygdala is a small part of our brain and is part of the limbic system. Now, this causes two problems. Firstly, the traumatic memory cannot talk to other memories, so we can't integrate the traumatic event to the rest of our psyche. Secondly, the traumatic memory is stored in its raw form. This means that each time a reminder of the traumatic event emerges, the person may feel as if they were experiencing the trauma all over again. In EMDR, we like to talk about the Adaptive Information Processing Model, or we call it the AIP model. The AIP model is an academic term for the old saying, time heals. It suggests that we are all equipped to process trauma naturally. Given enough time, the brain will start making connections between the traumatic memory with the past and new experiences, and the impact of the traumatic memory becomes smoother because we would have wider perspectives. However, for some people, AIP is not able to activate on its own, or they might begin to associate the traumatic memory with unhelpful self-beliefs. This can be caused by many factors. It can be caused by the person's physical and mental capacity at the time of the trauma, the severity of the trauma, the frequency of the trauma, and their age at the time of the trauma. For instance, research show that children who have experienced developmental trauma are more likely to engage in high-risk behaviors and develop chronic illness late in life. How does EMDR work? EMDR helps people to activate AIP by uploading traumatic memories from the amygdala to the rest of the brain, so we can make new meanings of our experiences. In sessions, the therapist guides the client to process the memories while engaging in bilateral movements. This can be eye movements, so I can be moving my eyes left to right like this. Or this can be hand tapping, so tapping my leg gently from left to right. Or it can be something more creative, like drumming, drawing, or even listening to music. The purpose of bilateral movement is to keep the brain so busy while processing the traumatic memory so that it can protect the client from getting overwhelmed when the target memory is making connections with the rest of the client's life experiences. This will in turn eradicate the negative self-belief held by the client as a result of the traumatic experience and allow the client to discover and explore new insights relating to the event with the therapist. When the trauma is fully processed, the therapist will guide the client to install a positive self-belief in order to help the client to reframe the way they view the traumatic event. Thank you for watching. If you want to know more, you can read more about the 8 phases of EMDR below, or read my blog post on how creative EMDR may support adopted young people and help bereaved families to find new meanings in life. Bye!